Hi, my name is Ceanna Doria and I will be presenting on oxycodone. What is oxycodone? Its official name is oxycodone hydrochloride. It is used to relieve pain severe enough to require opioid treatment. This can consist of strong pain relieving, sleep inducing, and anxiety relieving properties. This is used when other pain meds do not work well enough, and it belongs to the group of medicines known as opioid analgesics. Its street name goes by the name of Oxy. Category: Oxycodone belongs to the opioid analgesics, which are pain medicines. It is classified as Schedule II controlled substance. This can indicate high potential for abuse, leading to severe psychological or physical dependence. It is currently accepted in medical use in treatment of the U.S. regarding management of moderate to severe pain. It's a semi-synthetic opioid derived from thebaine, natural component of a poppy plant. The FDA has implemented a risk evaluation and mitigation strategy known as the REMS program for extended release opioid formulations such as Oxycontin. History: Oxycodone was first synthesized in 1916 in Germany as potential non-addictive alternative to traditional opioids such as morphine and heroin. It has been in clinical use since 1917, and its potential for abuse was not detected until the 1950s due to the introduction of Percodan, which is a combo of oxy and aspirin. Its popularity increased in the U.S. with marketing of Oxycontin. It's a controlled release formulation in 1996 due to the marketing from Purdue Pharma, which later led to the misuse and addiction. Purdue Pharma then faced significant legal settlements. Methods of use: Oxycodone can be ingested orally, snorted, or injected. Abusers can often chew the tablets. They can often crush the tablets, then snort the powder. And it's also an injection because oxycodone is water soluble, so crushed tablets are dissolved in water, and the solution can then be later injected. Medicinal use: Oxycodone can consist of treating acute pain, cancer-related pain, chronic long-term pain, some cases labor pain. In other cases, it can be combined with other analgesics known as acetaminophen, aspirin, or ibuprofen for enhanced pain relief. As for acute pain, this is typically pain following the surgery, known as fractures. As for chronic long-term pain, this can require continuous around-the-clock analgesic treatment. The legality of oxycodone. So its legal status can be broken down through the Controlled Substance Act, the CSA Schedule II, high potential for abuse, and strict regulation. As for the CSA, in the U.S., Oxy is classified by the DEA as a Schedule II drug. As for high potential for abuse, Schedule II drugs have a high potential for abuse, leading to severe psychological or physical dependence. Lastly, strict regulation. These prescriptions cannot be refilled. These strict protocols, consisting of the REMS plan, can govern how medicine is prescribed or dispensed. The effects on brain chemistry. Oxycodone can alter brain chemistry by activating the mu opioid receptors. This can lead to an increased dopamine release in reward pathways, causing euphoria and pain relief. They can also inhibit the action of GABA neurons. By blocking GABA, oxycodone removes inhibition, allowing dopamine neurons to flood the brain with dopamine. Toxic levels. Oxycodone's individual tolerance can be seen as chronic pain patients, which may tolerate higher concentrations, while opioid-naive individuals can experience fatal respiratory depression with lower doses or concentrations. So we have a chart listing from 10 to 100 nanograms per milliliter. That's the typical therapeutic range for pain management. Then we have 200 nanograms per milliliter. Those are the concentrations at which toxicity can become significant in non-tolerant individuals. Then we have specifically at 0.69 milligrams per liter. This is the mean post-mortem concentration in cases attributed to oxycodone toxicity. Dosage: non-opioid tolerant adults. Single dose may cause fatal respiratory depression. Lastly, its metabolism. Oxycodone is metabolized by liver enzymes, so any interactions with other drugs can increase these oxy levels, leading to toxicity. Tolerance info. Patients who are considered opioid tolerant are those who have been taking, as far as a week or longer, at least 60 milligrams of morphine daily, 8 milligrams of oral hydromorphine daily, and an equal analgesic dose of another opioid. Withdrawal symptoms can include hot and cold flushes, sweating and goosebumps, and feeling anxious and irritable. Overdose symptoms can include extreme drowsiness, muscle weakness, pinpoint pupils, slow heart rate, and possibly death. The cost. Oxycodone is a moderately priced drug starting as low as $17.37 using a good RX coupon. This is usually 68% off the average retail price listed at $54.80 for the most common version. Trends of usage in the US versus the world. In the United States, they are projected to reach $5.68 billion by 2034. Hospital pharmacies are the ones who have led the market, specifically in 2024. As for the world, global oxycodone hydrochloride market is valued at $4.36 billion in 2024. Its market is expected to grow at CAGR of 2.68% from 2025 to 2034. Trends of usage in age, gender, and ethnicity. Adults 12 to 17 have a drug use disorder at 6.9%. Young adults have a drug use disorder at 18%. Adults 26 and up have an 8.6% drug use disorder, and elderly 65 and up have a 3.9%. There's a 10% increase in opioid prescription rates, which lead to an estimate 7% increase in opioid-related deaths. Interesting facts about oxycodone: that oxycodone may be habit-forming, or it can cause serious life-threatening breathing problems for the first 24 to 72 hours. Drinking alcohol or using street drugs on top of oxy can increase risk of life-threatening problems. And if taking oxycodone extended-release tablets, swallow them whole, do not chew them, break them, divide, or dissolve, as too much oxycodone at once can be harmful to your body instead of slowly over 12 hours, according to Medline Plus. Here are my references. Thank you.